So, megaloblastic anemia, as we all know, megaloblastic anemia is caused because of deficiency of vitamin B12, cobalamin deficiency, right? So, inadequate intake is basically where there are three types: pernicious anemia, vitamin B12 due to vitamin B12, all. First one is pernicious anemia, vitamin B12 deficiency, or third one is folate deficiency, right? I'll explain its mechanism further, right? So first of all, let's discuss about vitamin B12 metabolism, right? So what happens in vitamin B12 metabolism? Non-vegetarian food is richest source, and your vegetarian food is poor source. So remember this also. So basically, in the stomach, vitamin B12 forms a complex in the duodenum. Then, through pancreatic protease and vitamin B12 and intrinsic factor make vitamin B12 intrinsic factor complex and absorbed in ileum. Where it is absorbed, just remember very simply, it is absorbed in ileum through epithelial cells with the help of intrinsic factor, right? With the help of intrinsic factor. So it is very, very, very important, right? So vitamin B12 plus intrinsic factor plus transcobalamin 2, right? So just remember intrinsic factor receptors present in ileum, which is called tubulin, right? And this this is how it is absorbed in the ileum. Folic acid deficiency can develop quickly if there is inadequate intake. It is mainly present in pregnancy, infancy, malignancy, and hemodialysis. Now, this megaloblastic anemia are of three types: pernicious, vitamin B12, and folate deficiency. First of all, we will discuss about pernicious anemia. It is autoimmune disorder in which the antibodies are released against the parietal cell. So parietal cells are damaged. Due to this, there is no intrinsic factor release and there is vitamin B12 deficiency. This is mainly in case of atopic gastritis. I'm just giving a brief idea about the important questions. And maybe in case of carcinoma also, so there might be a gastric adenocarcinoma, right? So this gastric adenocarcinoma is mainly at the site of where the parietal cells are released, fundus and body cells of stomach, right? What are the signs and symptoms? Glossitis along with stomatitis. Then there is peripheral neuropathy and gastric atrophy, right? So this peripheral neuropathy and gastric atrophy is a sign which is not shown by the folate deficiency anemia, right? So remember this. It is shown by pernicious anemia only, right? Now it is absent in folate deficiency anemia, right? So why there is a neuropathy? Why there is a neuropathy? Because of vitamin B12 deficiency, methyl malonyl CoA increase, which is required for which is converted into succinic CoA, then which form myelin, right? So if B12 is absent, then this will increase, right, in the deficiency, right? So which produce in the deficiency, it produce toxic metabolites, malonic and propionic acid, right? Which damage myelin sheath, right? There is one question which is very, very important. Which part of this mainly cause peripheral neuropathy? Posterolateral spinal cord. Due to loss of here, there is a atrophy. So due to this, this is the center for the pain conduction. Pain conduction. So there is loss of pain and vibration sensation. Right. Now, in case of peripheral smear, you can see at the earliest macrovalocytosis, right? Hyper segmented neutrophils, that means multi-lobed, like this: one, two, three, four, five, six. More than five lobes, right? Mainly in the neutrophils, right? First, second, then third one, nuclear remnants, which are generally absent on maturation. So these are called Howell Jolly bodies, right? So remember these 3 points. In case of pernicious anemia, vitamin B12 deficiency anemia, macroovalocytosis, hypersegmented neutrophils, and nuclear remnants. Now you can see MCHC per gram per DL is normal. And one more thing, you can see fine basophilic stippling, right? And you can see Cabot physics. Remember this, right? Now, features common to all forms of megaloblastic anemia and isocytosis: normochromic macrocytes, MCV more than 100, lower reticulocyte count, yes, which is very, very, very important. There is low reticulocyte count. Just remember this hypersegmented neutrophils, as I've already told you, dissociation between nuclear and cytoplasmic maturation. Accumulation of megaloblasts in bone marrow. So, bone marrow biopsy shows from where we have to take posterior iliac crest, where you can see myeloid erythroid ratio is 3 is to 1. So, in case of myeloid megaloblastic anemia, it is ratio is reversed, right? And reticulocyte count is reduced because the size of cell is more while passing through small blood vessels. Hemolysis occurs, and you may see the sign of splenomegaly, jaundice, and nucleated RBCs, right? Because vitamin B12 is decreased required in DNA synthesis. Vitamin B12, vitamin B12 is mainly required for vitamin B12 is required for DNA synthesis because nucleus maturation not occurs. So nucleated cell we get at last and apoptosis of nucleated cells. That's why there is decrease in reticulocyte count. In case of pernicious anemia, you can see as of this already told you, tongue, you can see shiny, glazed, beefy, glossitis, stomach atrophy at the fundus and body area, bone marrow, hemosiderosis. Right. Just remember these, all the features.